Let's talk about Botox.
Okay.
Is it as toxic as people say it is?
Botox and filler get confused as to what they are. Botox goes in a muscle of our face to relax that muscle or immobilize it, paralyzes it chemically. We call it chemical denervation, taking the nerve signal to the muscle away. Over time, the flexion of those muscles on our skin causes wrinkles to form.
So talk to me about when a patient comes in and they're like, okay, I want a bleph done. Like in your head, you obviously know like what would be best for them.
For
so
sure.
Like how often of the time are you being like, yes, let's go with that, or no, you need something completely different?
Yeah, more often the latter. Not completely different, but just more comprehensive. People think of plastic surgery, and the first thought is generally transformation. My practice is completely rejuvenative. I do not transform anything, meaning I'm taking things that changed and putting them back in a direction from where they came from. And I think misunderstandings about filler and biostimulators. I can tell you definitively that that is not true.
I actually just went through my second round of Ultra. What are your thoughts on that?
If the intent is to improve your skin quality, great. Win, huge win. Do it. It will help. The second we cross into, this will actually give you a little facelift, or this will actually tighten your skin. This will make it so you don't need this, so you don't need that. That is where I kind of say like, run, don't walk away. They cause problems, big problems actually.
Welcome to the Empower Podcast, where wellness meets real life and empowerment becomes your way of being. I'm your host, Sam. All right, Dr. Chesnut, welcome to the Empower Podcast.
Thank you so much for having me. Very happy to be here.
I'm so excited too. I feel like we've been trying to work this out for the last 8 months or something.
You finally got it. Finally nailed it down.
I know,
Yeah.
and I've been so excited because I obviously keep up with you on social media, and I just love everything that you stand for. For me personally, as like an outsider, when I look at the aesthetics and plastic surgery world, there's such a like black and white standpoint. Like you either do the aesthetics, you do the filler, you do the surgeries, or you don't. You take a natural approach and you do all the holistic stuff. But like, I don't know about you, but I truly do believe there's a world where you can do both.
Right.
Like approach it more naturally, which I love that you do.
Yeah.
You take more of a holistic standpoint. I can't wait. Like I have like a laundry list of topics and questions I want to ask you, but I want our listeners to get an inside scoop on your background because I think it's very important for where you're at today of like how that came to be. So can you walk us through where your journey started specifically with school? Because weren't you planning to go to school for nutrition?
Yeah.
And how did that change?
I was a nutrition undergrad, actually. Yeah. And it's funny that you mention all those things because my practice is very much what you just mentioned. It's this like intersection of longevity, metabolic health, plastic surgery, aesthetics, performance, and ultimately that's kind of what it all boils down to is kind of helping people feel and perform like themselves. So it is those things. That's to my head, they're not mutually exclusive. They're all actually integrated a little bit. And that definitely comes, I mean, we could go back even before school. I come from a household where my mom was a nutritionist and a dietitian technically. And I didn't know it at the time, but she was very much an outside the box thinker. She was just kind of my like odd nutritionist mother who kind of like, I guess we would call it intermittent fasting or time restricted eating. She just sort of like only ate once a day and that she did it because that was her thing. We're talking like the 70s, 80s and 90s when she was doing these things and there was no coolness about it. She just had sort of figured out that worked for her to do something like that. Or, we didn't like when margarine came out, that was a really big one, the American Dietetics Association, her organization was saying like, this is healthier than butter. This is what we should be eating. And I lived in a house where she's like, heck no.
Yeah, we're not doing that.
We are not eating that. That's like atrocious for you. Like beyond a hydrogenated oil, we were a pre-seed oil type of family where she was like mixing olive oil with, grass-fed butter. And that was what we'd spread on. It was very interesting when I look back. So I'm like, she was way ahead of her times, and I don't even think she knows now how far.
So she's still like that.
Yeah, but there's other funny things that mix into it too. So
like she lives balanced too in a way.
Yeah, very much.
Yeah.
Like nothing was extreme. It was just some of her practices. When I look back on it now, I'm like, that's exactly what has now come into fad,
instilled,
basically. And so I think that taught me to be a critical thinker, basically about even within the margarine one really spoke to me because it was heavily pushed that was the thing, and the butter was terrible for you, and turns out couldn't be more opposite, right? Like now you can't even get that anymore in the same way, those hydrogenated oils that they were selling then. So anyway, that was my kind of like upbringing, which I don't think I had a lot of like consciousness of that until now, more recently. So it's kind of fun to look back on. But then I was a nutrition major as an undergraduate. I went to the same undergraduate school that my mom did. I was a collegiate athlete. I was like, 17, 18 years old, kind of following the path that I, of least resistance and what I enjoyed. And, but I got to do all those really fun things, and I majored in nutrition, and medicine was always in the back of my head. And, but I didn't know much about it. I don't have my parents aren't physicians or anything like that. So I started exploring, and then boom, medicine kind of came like, yeah, this is what I want to do. You can do a lot of different things. I knew I wanted to do procedures. In medicine, we say there's like doers and there's thinkers. And I like both. One of my core values is definitely like deep thinking and innovation and stuff, but I like using my hands and creating things. So that, narrowed down a lot of medicine right there. And, that gets into everything from like, you could be an orthopedist, which is very like, carpentry kind of following algorithms. I tended to gravitate towards things that are very more creative, like 3D spatial. And so that's what led me to my ultimate path. I did a residency in dermatology before I went into my surgical subspecialty. And then after that, I did all my surgical subspecialty training, which we call a fellowship. And that's what led me to this route of doing like facial plastic surgery.
I love that. Yeah. What a cool story.
Yeah, it's interesting.
So through your time with schooling and then landing into the dermatology space, did you see like any red flags or anything that maybe you didn't agree with in the industry, like specifically aesthetics, dermatology, plastic surgery, that you're like, I want to do things different? Yeah,
I did. If there's a mid step in there where, my mom's sort of wildness, I adopted, I would say, with a goal of achievement, which was athletics for me at the time. Like I figured out that if I kind of like listened to her and did some of these things, I was better at sports, which was wildly important to me at the time. And so I got to see like how some outside the box thinking moved the needle in this thing that was important to me. That's when I first started adopting, right? And I just tell that story to say that when I got into medicine, similar things were happening. I was very fortunate. I trained at UCLA. When I was doing dermatology, I knew that was not my end path. That was like the first step of residency to go into fellowship training of surgery. So I was much more paying attention to my world of plastic surgery, regenerative medicine. It wasn't even called functional medicine, but those types of things coming at the time, which was like some primary care based things, some surgical things, and how those all mix together with even like devices and filler, which is very much in the aesthetics dermatology space. And I got to work with, I think I had 27 different attending physicians that I was working with in Los Angeles. I was at UCLA. And so you just get a broad spectrum, and you start to identify people that are inside the box thinkers, outside the box thinkers, how everybody works, and you just start to integrate. And I wasn't in a political capital position to like really make changes. It was just like storing ideas away for when it was my world.
Your time.
Yeah, exactly. And I definitely saw things I didn't like and things I did like around everything from surgical techniques to filler to devices to even the metabolic health and recovery, because that was just like a very unique special interest of mine. That was back then, it sounds like I'm so old, but when I was training then, like nobody was thinking.
I was about to say they didn't probably talk about it much.
Heck no, not even a little bit. But I had this athletic world where red light therapy, hyperbarics, I knew that these were used for recovery. I was training at a very high level at one point, like in the Olympic development program, and these were tools that were being used. And so then I'm in medicine, but over here it's like, well, we can't use those for patients. I'm like, why? Did
you ask that?
Well, yeah, in my appropriate way. It was more of like a rhetorical, why are we not using these? But it really boiled down to where I am now. I'm viewing every procedure that I do as a metabolic event, if you will. Like I treat my patients like athletes, just like I treat myself.
That's so cool.
And so I'm using the same tools, and now they're very much more in fad. They're much more accepted. But I would love to think that I pushed that a little bit too in that direction.
That's amazing.
Yeah.
I want to know like the specifics of medical school too, just because I've come from a medical background. I was in the biotech industry and actually started in dermatology.
I
so
knew
I
that.
have a little bit of insight. But when it comes to medical school, like how much were you all taught around proper nutrition, like supplements, like wellness things that patients should be doing and what you should educate on?
Yeah. So I see this now, and this has come up lately a little bit, where medical students get, 12 hours on nutrition training and it's not far off.
Wow.
And I went to one of the best medical schools in the US, and we did have a class on nutrition. It's very biochemistry heavy. And I disagreed with a lot of what I was learning. But, my job at that point was get A's. So, honestly,
pass,
not even like if you want to be the cream, you have to like do the things. You got to jump through the hoops. There's another test. There's another interview. There's another whatever coming. Sure. And so at the time, I just remember like, well, having had an undergraduate in, I'm like, well, I know more about this and I disagree with these things, but I'm also grasping the overlap with biochemistry and pharmacology. And so I get that, but I also think a lot of the things that we learned, not only did we have very little, but some of the things we learned were counterproductive, I would say. It was just like everything else. It was a bit hijacked by industry, the food pyramid that just changed, those are the types of things we were taught. So there's that, and then there's things that were just flat out omitted, like some of the lessons were valuable. Like you need zinc to help with your wound healing. That's a really important thing to know, So, okay, those are good. And I know this is your world very much as well. But, beyond those types of little nuggets, I would say it wasn't
do you see that it's changed at all since you were in school, or is it pretty much the same?
I think that there's a forced evolution of those that are innovative, progressive thinkers to have to change a little bit. Yeah. I don't know that it has a lot, honestly, overall, but I do think that there was nothing then. There was no counterpoint or counterculture to it at all. It just was what it was. I do believe now that that's changed quite a bit because you have these, I would say, entire facets of medicine that have developed: integrative medicine, functional medicine, even regenerative medicine. These were they're not boarded now, which is this whole other side conversation about what boards mean versus what they don't mean. Because people are really good at this, but there's no like really oversight governing like this person is legit at regenerative medicine or at functional medicine. Those didn't exist. And now they do, and they're hard to argue with. Right. And so you can't ignore them basically. And plenty of people still will, and they'll get in their lane and they'll treat diabetes reactively and do their thing. But I think that's medicine's going very much in the other direction from that.
Yeah, I hope so. That's awesome.
Which ties into my whole surgical practice too, of like just being proactive, even like getting people ready for surgery. It's not recovery. There's this idea of like surgery is the event, and then that's it. You show up, you see your surgeon for surgery, and then it's over. Well, I have, my world is like big in the recovery because that makes the experience better and it improves your results.
When I feel like with so many, because I've had a couple surgeries in the past, and I feel like it's like, okay, you go to your post-op and then you're done.
Maybe.
And you're like, what's going on?
See the PA. Yeah.
This is wild. I can't believe I'm actually announcing this right now. But I had 2 breast augmentations, one after kids, but one before. And like, I got like no post-op notifications, reminders. So like, I didn't even go. Like, I didn't even know what was going on. And then I was like, wait, should I go back? And I called, and they're like, oh yeah. But it was like weeks after.
Yeah. And
it was just like a disaster. Everything was fine. But that's my point, is like, there should be a huge emphasis on recovery. And I love that you do that. And before I get to recovery too, I want to ask you about specifically just the way that you handle your clients, like the entire experience, because you look at it from such a holistic standpoint. Like your patient comes in and they're like, I want this. Like before you even go with what they say, like how do you handle the process from step 1 to 4 or whatever?
Yeah, well, so I live in Coeur d'Alene, Idaho, which is a beautiful little like retreat mountain lake area. And so all of my patients travel to me, like 100% of them, about 30% international, 70% from the US, Canada and things like that. And so there's just like, that is a hurdle to some degree, but it's also a beautiful opportunity, right? To have it's a retreat basically when you come to me. And so, the whole process starts well before you ever come, which is like getting you ready metabolically and physiologically and inflammatory wise for your procedure. So it's not even just after recovery. I'm like, 8 weeks before, we're doing things for hypercapnic tolerance to make your ability to tolerate like high CO2, low oxygen better, which makes you recover from your anesthesia better and makes you more metabolically flexible. If you're somebody who fasts, we work with that before. If you're not, we don't. Okay. Certain supplements that I'll start preoperatively versus weeks before versus right before versus whatever. Even things as simple as like changing we'll dive into like, what cleaning agents are you using in your home? Can we optimize your inflammatory profile just by getting rid of some of those things? What are you eating? So there's this big pre part of it. But even before that, because patients are coming from afar, it's a challenge to just connect with them. And so I like to do this little photo screening process where you basically send photos into me, tell me what you're after. The better photos and the better information you send me, I look at them myself, and then I can get back to you and be like, okay, about 80% of the time, not a good fit, not the right thing. And then I choose about 20% of people where I'm like, you're a good fit. I think we'd work well together.
Oh, wow. So 80%. You're like, this is not a good fit.
Yeah,
wow.
About 80%.
Okay.
And for various reasons, right? Yeah. That's a whole nother topic. But like about 20% of people, I'm like, you're my person, right? We're going to do well. Because if I've learned anything in my career, it's that the relationships are wildly important to me. We become part of each other's lives quite intimately forever. And
trust on both ways.
Oh my gosh. Yeah. Really, we're choosing each other basically, which is, I think, a little bit of a different mindset. But I love that. And it makes my life much more fulfilled. When I look at my values of what I value, it really hits with some of those to do it that way versus like I do one surgery a day. I don't do this one, and this one. It's like even if it's not that big, I'm yours today. That's all I'm doing. I don't know. So I like those things.
And I've heard too on a podcast that your surgeries are a lot longer.
Yeah, they are.
Because of the intention you put in and detail?
There's detail, there's intention. I do things that are really minimally invasive, meaning like if I do need to open to get access, I'm usually doing it through a very small space. So it just takes a little bit longer. It's also significantly harder on my body, which is why you see these cupping marks all over me.
I had a big cupping on the neck.
Yeah, I had a big operating week last week. And so, it's a beat. Like if I could just like take something and open it all the way up in front of me, I can just stand here like this. But if I'm working through a space, that's 2 centimeters big, I have to like kind of get down and work around to see what I'm doing. And anyway, so it takes a little bit longer. And that also definitely plays into that one patient per day idea for sure.
All right, quick break to talk about one of my favorite skincare lines, ClearStem. If you're like me and maybe you're in your 30s or could be even in your 40s and you still occasionally deal with breakouts, you guys have to try ClearStem. I'm at the stage of life where I am just thinking about anti-aging, right? Like fine lines, keeping my skin hydrated and looking glowy. But I've noticed there are so many traditional anti-aging products that clog your pores and so many acne products that leave your skin feeling dry and irritated. But with ClearStem, you don't have to choose between acne care or anti-aging. ClearStem is the first clinically tested skincare line made with 0 pore clogging ingredients. That's their clear pore promise. And when I think of ClearStem, I think of skincare that actually protects me from acne and aging at the same time. I know you guys see it all over my Instagram, and 2 products I really love are the Bright Me Up Toner and the Hydra Glow Plumping Moisturizer. So Bright Me Up is this product I just honestly keep recommending to anyone and everyone because it gently exfoliates and helps my skin look brighter, smoother, and just like more even. Then I follow it with Hydra Glow. You guys, this product is amazing. It gives my skin that plump, hydrated glow without feeling heavy or clogging my pores. Most anti-aging products break you out, and most anti-acne products, they age you. But now there's ClearStem. Discover the ClearStem difference because clear skin changes everything. And you guys know I've been partnering with ClearStem for a while now, and I am so excited to share a new special offer just for you. Go to clearstem.com/SamCFit, add the free mini HydraGlow plumping moisturizer to your cart, and use code SamCFit at checkout to get the mini moisturizer free when you spend $75 or more. That's ClearStem.com/SamCFit, add the mini HydraGlow to your cart, and use code SamCFit at checkout for a free gift with purchase when your order is $75 or more. Let's take a break to talk about one of my favorite sponsors, Remy. Y'all know I love my nighttime routine between my red light, mouth tape, magnesium, and all the things I do to prioritize recovery. I just take sleep seriously. But one thing over the last couple of years I did not realize was affecting my sleep is jaw clenching. Listen, we can carry a lot, whether that's work, working out, motherhood, life. I was just carrying way more tension than I realized over the last few years. And I would like wake up with this tight jaw and then like a lingering headache throughout the morning. And I just feel like I hadn't fully recovered overnight. And that's when I found Remy night guards. And they honestly, y'all, have been a game changer for me.
About 30% of US adults grind or clench their teeth at night. Remy's custom night guards are clinically tested to help protect your teeth from grinding. They reduce jaw tension and facial muscle strain and improve sleep quality. But what I love is that you're getting that same professional level quality and comfort as a dentist-made night guard, but about 80% less, without having to go into the office. It's a no-brainer. Let me tell you how they do it. So they send you an impression kit, you do it at home, you send it back, and they custom make your night guard. It's such a small shift, but it's really made a difference in how I feel just waking up every single day. No more waiting rooms, no overpriced bills, just a better way to protect your teeth while you sleep. And I've got a good offer for you. You can try Remy risk-free. Go to shopremy.com/SamCFit and use code SamCFit to get up to 50% off your night guard at checkout. That's a good deal, guys. That's 50% off at shopremi.com/SamCFit with code SamCFit. Thank you, Remy, for sponsoring this episode.
So talk to me about when a patient comes in and they're like, okay, I want a bleph done or I want a brow lift or whatever.
Yeah.
Like in your head, you obviously know like what would be best for them. So like how often of the time are you being like, yes, let's go with that, or no, you need something completely different?
Yeah, more often the latter. Not completely different, but just more comprehensive than that. Like you just said a great one. Someone wants a bleph, and a bleph is a blepharoplasty, which is an upper eyelid surgery.
I see that everywhere right now.
Everywhere.
It's all over social media.
And that you're hitting on a good one for me there, because people think that they have extra eyelid skin. Like two of my patients last week had a 40-year-old and a 42-year-old last week, that's young. And they both, I have extra upper eyelid skin. And so when we really get into it, it's like, well, that's just a fixation point where your whole scalp and forehead sink down to. And so it's actually not that you have upper eyelid skin excess, it's that everything above it is sort of sinking down, and that's where it's fixated. And so it's the watershed basically at the end of the road. And so the actual answer is you need a little bit of support to your forehead and your brow, and then all of a sudden look what happens to your upper eyelids.
Wow.
This is a very common conversation for me, that's why I kind of want to know what somebody's interested in, like what areas bother them more than like what procedure they think they need, because I guarantee that person goes to their, I'm just going to say, quote, local plastic surgeon, end quote, and they're going to get a blepharoplasty because that's what they want. And that's certainly a way to make them happy. They don't know any better. But then you start to get into these like results that are like, well, that's a 6 out of 10. And they're happy because they don't even know what 7, 8, 9, and 10 look like. But over time, that may not do as well. Or worst case, you get pushed into something that looks a little bit abnormal or unnatural, which is really common with the eyes. And that's based off of our neuroanatomy. And so very commonly, I'm saying, what are you interested in? Okay. And then uniquely to each person, I get to see them move. I get to see photos, and I can say, okay, yeah, maybe you do have a little bit of extra upper eyelid skin, but that's the third thing on our priority list after making sure your brow's in the right place. And then, you actually have one eye that's significantly smaller than the other that you notice when you take photos or when you get tired, when you have a glass of wine. Like, okay, we need to, and a lot of people see that, like, oh, my droopy eye or my lazy eye or whatever. Like, okay, great, we need to correct that too. We don't want to leave that behind.
Right.
And so it's a little bit of comprehensive, but that's great because then I can do smaller things instead of doing one big abnormal thing. In my opinion, I get to do all the little things that fit in. So that's kind of how that
I love the way you look at it. And with the bleph specifically, it's like, okay, so you get the bleph surgery for maybe the people, like you said, they just need to be kind of like raise everything. But it's like with continued aging, like that issue is just going to come back, right?
For sure. Yeah. Because you haven't addressed the underlying problem. And so that's like, I don't love to be absolute, but if you're in your 30s or 40s and you're thinking that you need an upper eyelid surgery, like pause, caution, look at what's actually happening there. Because that's probably not the issue. It's quite analogous to people don't like the folds that form along the corner of their mouth from their nose down. People call them smile lines or, nasolabial folds. And they're a fixation point too. As your cheek sinks down, it starts to fold there. Doing an upper eyelid surgery for things that are falling from above would be like cutting that out directly because your cheek's falling. Well, no, lift your cheek. And then you don't have to worry about what's happening down below because it's taken care of by the upstream effect.
Right.
Yeah.
So you mentioned age.
Yeah.
So how much does age come into play with wanting to get these procedures? Like,
you
know what I mean? Because you think, okay, am I too young? Because even I myself, I'm like, when am I going to need a brow lift?
Right.
Like things like that, you know?
And there's different things. Like I said, one of my patients last week who was 40 had genetic predisposition to some things.
Right.
And then she'd done some treatments after that exacerbated things and made them worse. And she had started like a GLP drug that made her lose some weight, and that changed. And so she had a kind of this like perfect storm of things happening. Because that would be definitely on the younger end. But there's a genetic predisposition in that situation usually. When we talk about, so just to like lay this out from the very get-go, I think this is important to understand for everybody is, people think of plastic surgery and the first thought is generally transformation. You're taking something that didn't exist and you're making it different than it ever was. A breast augmentation would be a prime example of that generally, especially if you get it when you're like say in your 20s. You're just changing something. You never had that big a breast and now they're bigger, transforming. My practice is completely rejuvenative. I do not transform anything, meaning I'm taking things that changed and putting them back in a direction from where they came from, which with the face is just like undoing or restoring facial aging, which is often some gravity, a little bit of volume, some qualitative changes to the skin or the fat pads, support structure, things like that. So just to kind of throw that out from the get-go, I think that's really important to understand because when you're younger and you're thinking about a procedure, we really have to get into why are we seeking that out, you know? And it's a different threshold for everybody. Let's just say that. So my average age is probably like right around 50. That includes some people who are in their 60s and some people who are in their 40s, right? And I'll see somebody who's 63 years old, pretty advanced aging. You know, they're 63. They've moved down the line. They've lived a healthy life. They pulled all the levers that they can. They're doing all their wellness things, but eventually things catch up. And then they're finally like, I'm ready to see you. Like, let's talk about a procedure. Great. That exact same person, exact same physical body with a different brain in it, I may have seen that person at 45 because they're experiencing the same changes in a different way that's different for them, right? And they may only be 15% aged, 10% aged at that point, but it's crossed the threshold to them to cause, this is the most common thing I hear, is like this cognitive dissonance, this friction, this disconnect. When I look in the mirror, I don't look how I feel, right? This is my most common thing that I hear. And I actually kind of like to hear that because we're on the same page. Okay. Like my job is to make you look the way that you feel. Like I want people that are doing the things. They're trying to progress and they're, you know, working hard. They have kids and they're taking care of their life and their family and their craft, their hustle, their whatever they're doing. But they look in the mirror and they're like, I this doesn't match. Right. Great, I can help that match. That's my world, right? Yeah. And that happens at a different point for everybody, at a little bit of a different place. So sometimes I am doing procedures on people that are a little bit younger, that we've been through it, we know what we can accomplish. We're not doing that much. It's little baby corrections. And they're like, yep, that meets the value proposition for me. I want to do that. It pushes things down the road for them. The earlier you do it, the less invasive it is. I don't have to do as much to get to our endpoint.
Well, and that's my thought too. It's like, I don't want to turn 65 or 70 and then be like, oh my gosh, we got to do some work.
Yeah, it's a bigger deal now.
Right.
Yeah. And that's, but it's this, there's this avoidance behavioral bias that happens with people that's like kind of easier to do the thing you've been doing or to not make the big decision. And so that's honestly where sometimes like fillers and devices get into it as well. But at some point that behavioral pattern switches from the avoidance to like, okay, now I'm entertaining this, let's just say bigger decision to like actually definitively correct what's sunk and again, if you do it younger, less surgery, it lasts longer and the results are better. Meaning that I can get you at a better place at 45 than I ever could at 65.
No, you're good. Okay, so I have literally so many questions that just entered my brain. All right, let's start with the first question. So when it comes to, like you said, age, like there's some things that we can do from a preventative standpoint to help us age better.
For sure.
And prolong any kind of need for treatments, all the things. However, I think treatments can be like so useful, especially if you don't want to go straight to the surgery point. But what would you say is like a good starter pack for somebody that's maybe in their 20s or even in their 30s that's like, hey, here are the things that you can do today to help you age better over time?
Yep. So that's such a great question. And it's a little bit less sexy than I think people think. I talk about this on my social media a lot. Like, what would I do if I was in my early 30s again or late 20s and then into 40s? And honestly, the answers change a little bit by years or decades. The not sexy things are non-negotiables, really. Those are your metabolic health, your sleep. Are you like, what's your blood sugar? Like as I'm sitting here with my continuous glucose monitor on, like people don't talk about that enough, how much that can age you. And it's not just your skin, it's everywhere else. Our our face is our, interface with the world, quite literally. So there's so many important aspects of, I really love to nerd out on the neuroanatomy of how we interpret each other's faces, which you and I have been doing all day, basically. And there's a whole bunch of interesting neuroanatomy to interpretation of emotion and attractiveness and gravity and all those things, right? But a lot of that is just a reflection of how you're moving, what your skin looks like, what your face looks like, if it's natural, if it fits in this paradigm of what we're after. When it's unnatural, even like one part, we get this kind of funny feeling that you like, it's hard to explain, but you know it when you see it. Can't put your finger on it. People call it the uncanny valley a little bit sometimes. It's like an odd feeling, which is because it's activating the emotional part of our brain called our amygdala. That's like, I don't like this, but I don't even know why, because we haven't turned on the analytical part yet. But getting back to your question it's those things are the base for sure. Hands down, you need to be taking care of what's happening inside, right? Because your face is a reflection of your overall health, right? It's that window to the world that people can see. So, and it's not just skin, it's all the substructure of it as well, and how things move, which is an interesting concept if we decide to talk about Botox at some point. I want to talk about all the treatments in a second. My unique feelings on those, which it's not bad, but it's unique. And then you get to the point of okay, now I've been doing all these things. I've been taking good care. I've been photoprotecting when it's essential. And I know that's something you've talked about on here before. And I do believe in, I am very fair skinned. And if I'm out at noon in a latitude that I'm not built to be at, basically, I need to be protected. But at sunrise, I'm a different animal about that. I have a different feeling, I love a mentor of mine, Laird Hamilton, this guy who's like a pro surfer guy. And I love that he's like, we're the first culture to not worship the sun, essentially. Every other culture's worship the sun. So there's some the
enemy in a way sometimes.
Exactly. And there's some happy medium in there, right?
Sure.
So you can, get into that. So if you've done all those things, and then you get to the age where it's okay, now we're ready for some actual intervention. I know you've talked about microneedling and things like that. Those are great options. They're literally a controlled injury in which we take advantage of the regenerative recovery process that happens after the injury, and we use it for good. And you can help that.
So talk to me about what microneedling is.
Microneedling is just as it sounds. It's a bunch of little needles that penetrate through the barrier of your skin. It's like poking holes in the barrier, and then it causes these injuries release these signaling molecules that create new collagen, new elastin. They're basically trying to heal what was just damaged, but in that process, you get a little bit of a benefit out of it. You can take that to another level, and you get into things like lasers and these types of devices. And this is where we start getting caution, right?
Okay, yes. Give us the rundown.
Well, and I get this reputation as somebody who doesn't like devices, and that's not true at all. They just have to be used with the right mindset. So a prime example of that would be a laser. A laser I use with every surgery that I do, essentially.
Do you really?
Yeah. Well, because it does something unique that no surgery can accomplish, which is changing the qualitative components of your skin. That means everybody talks about collagen, which is fine. Collagen's important. It's the structural strength of our skin. It's the rebar. But I want more elastin, which is the recoil. And because people aren't generally complaining my skin's tearing apart. They're complaining that my skin's lost elasticity.
Right.
Okay, great. Well, let's rebuild that. That's much harder to rebuild. I always say that elastin's like a delicate flower. It's more susceptible to oxidative stress, UV damage, and it's hard to rebuild. And that's where the regenerative medicine part of it comes in, because we do this controlled injury, whether it's microneedling or a laser, and then we promote, via the growth factors that we're using, we promote the creation of more elastin in comparison to collagen, which is great. Now we have more elasticity in our skin. Lasers are really, 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 really good at that. They can create that effect qualitatively. But here's where the caution line gets drawn. If you're seeing somebody who's telling you that, okay, let's do this device on you, and it could be a laser, which is just a generic term. I don't even like to talk about brand names because we will.
There's so many.
We will and you can't keep up with them. They change all the time.
Right.
And it's one CO2 laser has 40 brands. And then this one has another. And you can tell where the marketing is heavy because you'll get the most questions on those. What about this laser? What about that laser?
Moxie and Ultra are the ones that I hear.
Right.
I actually just went through my second round of Ultra.
Okay.
Yeah.
Yeah.
What are your thoughts on that?
Well, it's great. Well, and so you're hitting exactly why. It's because if you're going in, and it could be a laser, it could be a radio frequency device, like a radio frequency microneedling. That's another. If the intent is to improve your skin quality, great.
That was the goal.
Huge win, right? Do it. It will help. different amounts of downtime, different amounts of effects, all kinds of really cool things in there that we need to know. The second we cross into, this will actually give you a little facelift, or this will actually tighten your skin. This will make it so you don't need this, so you don't need that. That is where I kind of say, like, run, don't walk away.
Okay.
Because now you're using the device, fillers the same way, devices the same way. They have a really great role until you're pushing them into areas where they're not meant to do what they're supposed to do, and then they cause problems, big problems actually. And so, like, my 40-year-old patient this week had similar treatments like this on her neck, and when I got into work on ultimately the genetic component of what was happening in her neck, it was a hot mess. It was destroyed. Her tissue structure was destroyed
from laser.
From devices in her neck. Well, that's common, right? It could be liposuction. It could be an injectable that's meant to dissolve fat. It could be often from devices, ultrasound.
And you can see that like in the tissue when you open it up.
It was interesting. I was working with my fellows and I was showing them, like, here's the outside of her neck where there's been no device treatment. Like, they weren't treating the outside, they were treating the middle. Perfect. Young, beautiful, great anatomy. The second we get into the area in the middle where they've been treating, it's just Swiss cheese, everything stuck together, glued together, fibrotic, melted fat. And she could see that on her, she knew that it was going to be that way a bit. But that's not uncommon. It happens in the face too.
Because it's just, people are just trying to do too much in one area for the wrong purpose.
I understand this. Like, there are all kinds of cognitive biases that go into this that are meant to be protective in a degree. It's the status quo bias, it's loss aversion, it's the present bias of, like, these are the simple things to do. You're 40 years old. You're probably not going to be jumping right to surgery.
Right.
So you explore these other options, and then guess what? You go to somebody who's like, yeah, that's of course the right option for you, because they're not actually assessing you. If somebody would have touched this person's neck, they would have said, like, those are your glands and the muscles of your neck that have sunken down. I can't do anything.
Yeah, but not everybody's looking at it.
No, they're not doing that. They're like, this is what I offer.
Yeah.
I offer a treatment that's supposed to lift your neck with a magical wand device, and that's what you want done. Let's do it. And it's like, well, that's the wrong person.
And another thing too is that, like, a lot of people go see different people. Sure. So it's like, how do you know that they know what you did in the past, right? Because that's like all things to take into account.
Yeah. And I just empathize with having to navigate that world. Honestly, it's very challenging. Because it's not even a credential thing. It's not even like, oh, you look at this person's an MD, this person's a PA, like there may be superiority in either direction there that has nothing to do with the credentials behind it, Right. And so it's challenging. And that's why, I think you need to kind of, like, don't research yourself to death, because that's like another just way of, like, aversion, but you got to be really careful with what you're doing and just heed it. If it sounds too good to be true, it's probably
they're like, you'll get a facelift with this injection.
With this device,
with
right?
this device,
yeah,
whatever.
That's why I say, like, if it's like, yeah, we can make that. I could make that a little bit better for sure. Yeah. Versus like, oh yeah, this is going to give you a non-surgical face. There's no such thing.
Right.
So
because I've seen that with, like, the nose jobs and things like that with filler.
Anytime I post a story on Instagram and my Lola blanket is in it, I always get so many DMs from you guys asking what blanket it is. I am genuinely obsessed with it. So they have so many different colors, which I really like. I actually have a couple in antique ivory, and y'all, it's just so beautiful. It instantly makes the room feel warmer and more elevated. And it's one of those blankets you see on someone's couch and you're like, okay, where's this from? But the softness is what really got me. It has that, like, luxury faux fur feel. I am so particular about the thickness of my blankets, and this one, it's like not too heavy or thick, but it's also not too thin, which is a hard one to nail down. And it's actually big enough for the entire family to pile underneath. The kids love it, Ian loves it, and it has quickly become the blanket everyone reaches for. And yes, it's machine washable, it doesn't pill or shed, and still looks beautiful after washing. Honestly, it has replaced all the blankets in our house. And for a limited time, our listeners can get 40% off select Lola Blankets products with code CMCFIT at checkout. Just head to lolablankets.com and use code CMCFIT to get 40% off your order. You guys, they have so many gorgeous colors, sizes, pillows, and even weighted blankets, so they always make such a great gift. Again, head to lolablankets.com and use code CMCFIT for 40% off select products. And when they ask where you heard about them, make sure you let them know our show sent you.
Okay, let's talk about Botox.
Okay.
Is it as toxic as people say it is?
So there's two worlds here. The first world is rubber meeting the road. What does Botox do? Because this could eliminate all the other conversations altogether for some people. Botox and filler get confused as to what they are. Botox goes in a muscle of our face to relax that muscle or immobilize it, paralyzes it chemically. We call it chemical denervation, taking the nerve signal to the muscle away so that it doesn't flex, doesn't fire. And so I just like to get to that. Why are we doing that in the first place? I'm a big first order thinking person. Why are we doing that, right? We are doing that because over time, the flexion of those muscles on our skin causes wrinkles to form, right? That's in a nutshell. There's a bunch of other things you could talk about too, but okay. So why are the wrinkles forming? Because when you were 20, you moved those muscles strong. Did you have any wrinkles? No. Why is that? What happened? Well, on one end of it, we have our skin is weakening to the forces that are placed on it by the muscles of facial expression. That's what they're called, the muscles of facial expression. They're very unique, very special muscles. When the skin weakens and the wrinkles start to form, then I say, okay, now we have this little tug of war happening. Muscles pulling on skin, skin resisting muscle. One side of that tug of war got weakened, right? The skin side. So just at first order thinking, do we weaken the strong side of this tug of war, or do we strengthen the weak side of the tug of war? The skin. So I just right there, like maybe we should be thinking about strengthening skin more than weakening muscle if our intent is really like wrinkle reduction, because
makes sense.
Our muscles, this is my opinion, this is not, this is not gospel by any means, but our muscles of facial expression are one of the things that make us uniquely human and allow us to communicate in very important and probably underappreciated ways. Like how we move our face is important. Subtle cues of emotion. And this is really interesting. Like even just with like what happens around the eyes, I could literally show you 500 pictures of slightly different eye flexion or brow flexion things. And maybe you can't exactly name what's happening, but in your head what all those little things mean. These little twitches of muscles will tell you key information about like how that person's feeling, what their emotions are. Are they attractive? Are they going to hurt you? What are they thinking? These are key. So you take those away and we've muted basically that little method of nonverbal communication. This is certainly rooted in my, I guess I said nerdy love of neuroanatomy and how we interpret what's happening in faces, because the second we see somebody's face, we have a very special region of our brain that lights up. And all it lights up for is called the fusiform face area. All it lights up for is when we see a face. Nothing else will turn it on.
Okay.
So if nothing else, we have real estate in our brain dedicated just to facial recognition, which tells you how important it is.
Absolutely.
And then from there, we get into emotion, memory, attractiveness, reward centers. Like all of these things fire off of that, depending on what we see. Like we know instantaneously if we trust somebody roughly, if we're attracted to them, like kind of what they're thinking, what their current state is. We get all that.
And I heard you say on a podcast too, like babies recognizing their mother's faces with the eyes and that spot.
Yeah, and babies do this too. Those same brain areas, I mean, they don't maybe have the same emotional intelligence to understand that, but from a facial recognition standpoint, they are doing that. And a baby will linger on a more beautiful face for longer than it will a less beautiful face objectively, right? So there's more to this. This is innate in us to some degree. With the baby and the mom thing, my point there is just simply like, if your baby can't communicate yet, that's one of your ways of communicating with them. And so this is not a shame thing at all. Like if you get Botox and you have a baby, it's fine, right?
It's okay.
It's not like, oh my gosh, they're ruined forever. No, not at all.
Yeah.
But you at least have taken some of your vocabulary away with how you would communicate with them, a little bit. So maybe just something to think about. And if you choose to still do it, do it. It's like, you can't say the word cornucopia around your baby, some complex word, like that doesn't matter, but like, it's something to think about. But it's the same with you and I, right? And so that just gets to, why are we doing it in the first place? Are there other options? You can still get Botox. I still do it to people sometimes. Just depends on situations. I'm just very thoughtful. I'm not just like blanketing people's faces in neuromodulators like Botox and Dysport and all these. I'm not just throwing it at everybody all the time as this regular thing, because I do want us to be able to have those key neuroanatomical cues to communicate with the world. Because like I said, our face is the interface with the world. If I can not mute it and let it function, great. I think the same way with surgery. One of my jobs in surgery is to get our muscles working the way they're supposed to work again. As they get lengthened out and stretched out and fat pads are in the wrong place, they don't quite fire the same and things look strained or funny. this is very much like a fourth order thinking in surgery, but like I want to get things like back in place so that those muscles can do what they're supposed to do again. So then it's kind of the antithesis of that to like immobilize them, with Botox.
Right. Yeah. Because is there such thing as like micro?
Yeah. So you can, this is what every like Botox injector will like pipe up and say and should say, like in my opinion, like we're not freezing the face.
Yeah.
Great. We shouldn't be freezing the face.
Like you should still see some movement and wrinkles in there.
But where the rubber meets the road in the real life, that's not always how it is.
Right.
There's like definitely frozen foreheads and eyes that won't contract, and and so. But then you ask, well, what's the importance of that? The frowning muscles, right? The 11s, people call them. Do you need to be able to furrow, frown, look confused, look concerned, look angry? Do we need to have that? I don't know, but it's there for a reason, in general. So. That would be the like first order thinking, or are we doing it? Should we be doing it? And again, I am not like dying on that hill that like this is, you should.
So in what cases do you inject Botox?
Yeah. So I would say if we've done all the skin strengthening that we can, and they're really bothered by some specific area of wrinkling, like let's say the crow's feet around the eyes or something like that, then I'm into the like, okay, well, let's use very small microdoses to just try to like weaken it so that it's not contracting so hard. We're back to the tug of war. We strengthened the weak side as much as we could, and there's still a little bit that's out of balance for what we're after. So let's weaken the strong side a little bit, maybe not as much as we would have had we not strengthened the other side first. More like balancing
it out.
Yeah, exactly.
So that's honestly, like full transparency, I'm so honest with my community. Like they know that I get Botox here and there. My goal, because I've been getting it, like no joke, since I was 25.
Yeah.
And my goal, the more I age and the more that I learn about just like wanting to age more naturally and gracefully, is like I want to lengthen out those sessions as much as possible and do more like treatments and good skincare to help with that.
Exactly.
So I find this like super interesting. So
and you would be a testament. You look great, right? You look everything. I mean, you can't argue with results to some degree.
And I will say, like my injector, she used to be a dermatologist, and so she kind of has like a different standpoint on when it comes to the face. She also is the only person that's ever injected me, so she kind of knows me like the back of her hand, and so that's helpful. And she's always taken a very like, hey, let's do less instead of like doing more. So I'm very thankful for that, because I know not everybody has that experience. But I'm like, I'd rather lessen the load with the Botox and do more natural things. So what are those things that we can do in between? Like do the, like, what are they called? I don't want to like throw out the brand name, but like frownies, but like the patches and stuff like that. Like, does that really work?
Well, so now you're into like a silicone patch or something that is meant to like support and immobilize from the outside, and then help promote a occluded, closed environment to regenerate. Like, is there any chance of those hurting other than what you spend on them? Heck no. So simple, like the time you take to do it, the hope you put into it that may not deliver all the way. Like if you have realistic expectations, it's like, this is a neutral to a positive with a lot of things. Great. Let's do those, home microneedling and rolling. I'm not like the massive fan of those things, but also like very unlikely to hurt overall, and maybe gives a little bit of benefit. Like, great, do those things. If you're into that and you want to spend the time and whatever, you're supporting the skin and that. And so getting back to like this kind of segues and dovetails perfectly with what you were talking about with like, okay, now we're into interventions, Botox being maybe one of the first ones, starting when you're 25 maybe, or 30s. Okay, now we got to do something a notch up from there. This is where it gets really challenging to navigate, because people are going to be telling you, oh, you should get some filler because you lost support in this space. You should, do the devices. You should maybe, filler's bad now, so we're doing biostimulators, whatever it may be. This is where I have an opinion on this, and it's based off of being in the face a lot. And I think misunderstandings about filler and biostimulators that are not bad. They're not blanket bad.
I literally just got something last week, so I'm so interested.
Sculptra, right?
Yeah, I just got Sculptra. Sure. So I want to hear your take, because I've heard you talk about it on podcasts, but I'm over here blushing because I'm like, oh Lord, what is he going to say?
No. And so this is the thing, is that this is not like oh, dang it. Like I get this question all the time, like, I just got Sculptra, am I doomed? No, no, you are certainly not doomed.
One thing I will say is like, I do not want to get filler in the face. Like I feel like it can look tasteful on some people, but I just don't want to put that in my face. But how much of a difference is filler still being for an object and then specifically Sculptra, because I'm hearing so much about that too.
Yep.
Can you explain the difference?
Yeah. So fillers are hyaluronic acid. I know you've talked about this on here before. So fillers are hyaluronic acid. They're a gel. They're cross-linked. And there's this thing that, they're natural. There's part of us. And like I would argue that, well, once we cross-link it and we're growing it with strep bacteria and things like that, maybe it's not really part of us quite the same way. And we know that that's not true, because you'll hear a lot of injectors even say, I view it as an implant, a temporary implant when they put it in. Okay, I like that mindset because that's more realistic. You put this temporary implant in, and once it's in, that's where the misunderstanding has just been happening. And honestly, we've learned a lot about this over the past even 15 years, since they've been in the US for a little over 20 years now, but really in heavy use for, call it 15, since some newer products came out that are meant to last a little bit longer, which means they're just harder to get rid of. Right. The understanding was like, they last 6 to maybe 18 or 24 months or something, and then they go away. Well, I can tell you definitively that is not true. And that's like the biggest issue with them right there. If people using them truly viewed them as more like a semi-permanent implant as opposed to a temporary implant, the whole world would be different, right? Wow. Because my 42-year-old from last week had filler over 20 years ago, one time, and it was still bothering her in her lower lids. I removed it during surgery.
How do you remove that?
Directly, I scoop it out.
That's like so icky to
I know.
think
it's
about.
Like, yeah, and there's sometimes...
Which is wild, because people don't realize it's just there.
Sometimes it's sitting, floating freely.
Wow.
Sometimes it's encapsulated, like you would imagine, like a breast implant gets encapsulated by our body, which almost by definition means that there was it definitely means there was an inflammatory response to the filler, that our body tried to wall it off. Yeah. Sometimes it is just sort of like diffused and integrated through the musculature, which is a bummer.
Is that migration?
Yeah, it's migration, or movement is what we're trying to call it now, because migration sounds a little bit more active, which is interesting, because I flashback 10 years ago for me, or 5 years, like when I talk about this, I'm like crucified.
Yeah.
Like, that doesn't happen. And I'm like, yeah, it does. And then now the field has evolved to be like, well, it does happen, but it's a good thing. Okay, and now we're spinning it to be a good thing. And I think that's not far off if we're using it with that mindset proactively. Now it's all the retroactive. It's good that it moves. Well, you didn't think it was moving when you put it in, You didn't think it was going to last decades when you put it in. And we know from surgical studies and MRIs, like again, filler is not bad. It can be a really important aspect, but it just has to be viewed the right way.
Like I will say, I'm sorry, I mean to cut you off. Because I've had my lips done a few times over the past decade, and like always go very, like not a lot.
Yeah.
But I had one instance where it did migrate, and I got it dissolved, which like that is the most uncomfortable situation.
Really? Yeah.
When they dissolve, I was like, that hurt worse than the actual process. But it was because I could like see it up on, which freaked me out, because I was like, that's crazy, that can happen. Yep. Is that because of all the movement that happens with the mouth?
Yeah, lip is a prime example. There's only one place for it to go. That muscle's sort of like a circular sphincteric muscle, like a sphincter. And so it just migrates through the muscle. The muscle's moving. It's the diffusion gradients, the physical forces that make it move. Lip is really common. And in some surgical procedures that I'll do, sometimes I'm working at the base of the nose, and with one of my fellows a few years ago, we looked at 50 consecutive procedures where we're working at the base of the nose, and people who'd had lip filler, and 49 of the 50, the lip filler had moved all the way up to the nose, even if it wasn't problematic. It was, we just know that it's moving, right? So that's a real thing. But those are different than Sculptra, which gets into this biostimulator category that's picked up steam as people have. And again, I don't think that filler should be dying. I just think that it's challenging from a business model, because that business model is based off of semi-annual or yearly treatments. And that's probably not the right answer. I personally don't love putting anything foreign in the human body. I don't use implants. I don't use permanent sutures in my procedures. I'm just very granola-y in that way, I guess. And so the filler doesn't fit my paradigm for that quite as well. And
so you will be like, no, we don't do filler.
Yeah, I don't. Yeah. I mean, and again, it's not a never say never. I do think it has a place. If it's like a very focal, like quite literally a spot, like this spot needs a little structural support for years. That's a really great
Totally
answer,
different,
great answer. But it's not like, well, then it's going to go away and I'll see you next year and I'll see you next year and I'll see you next year. It's like, this is going to be here for a long time. Let's make sure that it's meaningful. It counts when we put it in.
So for the biostimulators like Sculptra, and I don't know, does that like, is PRF and all of that the same thing?
Great question.
Would you say that's a more natural route?
Yeah. So the PRF, which is platelet-rich fibrin, which is like PRP, platelet-rich plasma, it's just a little bit thicker. It has fibrin in it. So it's like this cool gel. I use it in surgery, every surgery that I do. When I've finished working in an area, I'll lay down some of your own platelet-rich fibrin in the area to kind of like start the healing process off, which is really cool. Stops bleeding, gets everything kind of like kicks off the healing incredibly. You can also just inject that, right? Which gives a very temporary, but also very banal, meaning like non-harmful option to give a little bit of volume in that area. So like under the eyes, people use it. And so when I get that question, my answer is always like, it's very unlikely to be harmful unless you get like some significant bruising that leads to,
Under
some
the
discoloration.
eyes?
Yeah.
Because I'm planning to get that this week.
Okay, great.
Yeah. I'm getting married in September. So I'm like, what are a couple little things we can do? So I did the Sculptra. Yeah. I think she only used like a vial between the two sides and then a little bit of the easy gel underneath.
Great. Yeah.
I'm nervous about that because can't you swell?
You do swell.
Yeah.
Well, yeah, but swelling is part of, you're putting volume in right off the get, so you're going to swell from that. And then there's an inflammatory component to it. Like when someone in an orthopedic world uses PRP or PRF in a joint, they're trying to stimulate acute inflammatory response to cause healing to happen, right?
So it's a good thing, yeah.
Yeah, so it's a good thing. And so it's temporary. If you have realistic expectations as to what it's going to do, great. If you have like significant lower eyelid bag, like for you don't have those things, right? Yeah. But if you have like significant lower eyelid bags that are like bothering you and filler and PRF, and those are not your answer. You just need to adjust your baseline anatomy. That's what I do, right? But with you, I'd be like, why are you getting it? Like a little bit.
Okay.
And no, but I get it.
I'm so glad you're challenging me here.
Yeah.
I guess like, I will say I use some really good makeup that hides it, but I have like really dark circles.
Perfect.
So she said like a little, just like a hair. Like we're like microdosing it will help with the circles.
Yeah.
Versus like a ton of volume.
Yeah, because dark circles can be from superficial anatomy, from blood vessels, from sun damage, substructurally, shadowing from eye bags can cause them. Anyway, very like, I'm not going to say zero chance of hurting, 'cause that's never the case, but like very unlikely, and it might help a little bit. Great. That's a neutral to a positive again, like with very little risk.
So you think that's a better alternative for people than just going straight to filler?
Yes, for sure. And that's, again, this is my thought paradigm around. And I have a bias to this. I have to be open about that. Like I work in the face, I work around the eyes. I see the issues that filler causes there more than other people do. And so they're like just, quite literally in my face and in my patient's face, pun intended, I guess, like they're quite literally in my face, these like issues. So I would, be remiss to not say that I carry a little bit of a bias towards them in that way, but I think it's healthy to have both directions, right? I'm also not telling the filler world, like, it's the worst thing ever. It's like I'm going to challenge you too. Is this based off of a revenue model or what's best for your patient? Is this like, do you believe these things that we now know to be true? Because 5 years ago, I'm saying the world as a whole, we didn't really adopt this, but now we're talking about migration or movement. Now we're talking about the fact that we're not calling it dissolving anymore. This is very new. It's not being called dissolving. It's being called modifying, because the dissolver actually doesn't necessarily get rid of all of it. It's not like a magic wand where you just put in this dissolver and all things are erased. That's not how it works. Your dissolver goes in and it might reduce some of it, and I see this. Well, I'll have people who had problematic lower eyelid filler, small subset, but it's a problem. Like it's the main reason they're seeking me. They've had 10 rounds of dissolution and they come see me and I still find a bunch of filler, so
still there. You can't get rid of it 100%.
Right.
I know I always talk about staying hydrated, but honestly, the quality of your water matters just as much as how much you're drinking. And I wanted to make sure that the water I'm putting into my body is actually clean and free from harmful contaminants. And that's why last year I started using AquaTrue. I know I always talk so much about staying hydrated, but honestly, the quality of your water matters just as much as how much you're drinking. And I wanted to make sure that the water I'm putting into my body is actually clean and free from harmful contaminants. Last year, I started using AquaTrue. 3 out of 4 US homes have toxic chemicals in their tap water. And even though the water looks clean, standard filters often don't remove things like chlorine, lead, forever chemicals, or microplastics. But guess what? AquaTrue, it takes care of all of that. It's a countertop water purifier with a patented 4-stage reverse osmosis system that's tested and certified to remove 84 contaminants from your water. I genuinely noticed such a difference in the taste, and honestly, having that peace of mind knowing my water is cleaner and healthier, it's huge for me and my family. So head to aquatrue.com now and get 20% off your purifier using promo code SAM. AquaTrue even comes with a 30-day best tasting water guarantee or your money back. Take the guesswork out of pure, great tasting water with this exclusive podcast-only offer now at aquatrue.com. That's AQUATRU.com using promo code SAM. We are in the thick of summer, and honestly, the last thing I want to do when it's hot outside, especially with how active I am right now, is a long, heavy makeup routine. I don't know if anybody else is this way, but the older I get, the more I realize that less is actually more. So I used to think that I needed so many different products to look put together, but lately I've been loving Jones Road Beauty because everything feels effortless, it feels natural, and it actually enhances my skin instead of covering it up. One product that I cannot get enough of is their Miracle Balm. It gives me the prettiest natural glow, and I can use it as blush, bronzer, highlighter, or even like on my lips for a lip tint. It replaces multiple steps in my routine, which means fewer products cluttering my bathroom counter and way less to pack when I travel. It's so easy and quick to apply. I feel like I use it for everything, whether it's going to the gym, date night, or just when I want that quick, healthy summer glow. And on days when maybe I want a little bit more coverage, Jones Road just launched their new foundation stick. Oh, I love it. It's lightweight, it's buildable, it gives a medium to full coverage without looking cakey or feeling heavy. It's dermatologist tested and available in 30 shades. It also contains skin-loving ingredients like ceramides. All Jones Road formulas are clean, they're high-performing with no phthalates, sulfates, petroleum, PEGs, cyclic silicones, EDTA, or BPA, because clean beauty should just be the standard. And for a limited time, our listeners are getting a free full-size mascara with their first purchase when they use code EMPOWER at checkout. Just head to jonesroadbeauty.com and use code EMPWR. Again, that's jonesroadbeauty.com with code EMPWR to receive a free full-size mascara with your first purchase. And after your purchase, they'll ask you where you heard about them, so please support our show and let them know we sent you.
So talk to me about Sculptra.
Yeah, so Sculptra, and again, just to say, like, this is coming from a surgeon's perspective, not from an injector's perspective. This is meant to be a balance of things, right? And I'm not anti-Sculptra either. It's just the same thing as, like, it goes in, we talk about it biostimulating, creating collagen. Mm-hmm. It's a little carbohydrate basically, or an acid, poly-L-lactic acid, right? That goes in and it causes an inflammatory response to a foreign body, essentially. Mm-hmm. So is that good? Right. And then it creates collagen, right? And when I see the creation of collagen, and you can see some of these things even on my Instagram, it's like, the best way you could describe it to a layperson is like scar tissue. Mm-hmm. It's like sometimes it's these little white BBs, that have formed in there. Sometimes it's like matted together tissue planes. When I'm trying to go do a procedure on this afterwards, there's another product that's a calcium hydroxylapatite. That's another biostimulator. And I had a patient, this has been 2 weeks now. And it's just like, wow, it's a mess. Her anatomy is just a mess after we go in there. I was driving home talking to my wife on the phone after that. And she's like, how did your case go today? And I was like, it's just a challenging one.
Does the way they inject make a difference with that?
This is what all the injectors would argue, is that, it's just in the wrong plane, and I would argue that no, not particularly. Okay. I'm sure, yes, like if we get into the real nuances, right. But you're not going to give me somebody who was perfectly injected, quote, perfectly injected, and have there be no issues to a subsequent procedure. And again, surgeon's mindset, right? Like when you have a procedure ultimately down the road,
and you're looking inside,
it could be more challenging.
Yeah.
But then we get back, well, what if you don't want to have a procedure down the road? That's a fair question, right? Like maybe you'll never, ever, ever do anything. And that, okay, great. So that doesn't change what's actually happening right now though. Like, is that matting fibrosis, what I said, scar tissue, is that good for the muscles and the fat pads?
Is that why they say massage?
Well, the massage, that gets into trying to prevent nodules, like those little BBs I was talking about. And those have Sculptra changed a few years ago to how it was diluted. This was like, it was handcuffed by its original FDA indication to be diluted in a certain way. Everybody did it differently anyway. And now finally that's been updated to like more diluted a little bit more. So these nodules aren't as big of a deal.
Yeah. Cause she was telling me massage and I was like freaking out kind of.
Yeah. But there's all the, and that's fine. You know, that's largely changed, but that's one of the big reasons that people had it massaged. And so, you know, I just again, I like to think first order, like, why are we doing this? And I do not think everybody should have surgery. I do not think that, right? But I also just want people to know what they're actually doing and why. And I really respect injectors that carry that mindset into it and will have like when I do surgery on somebody, I'm not like, it's magic. Everything's perfect. There's no risk to this. You'll be great forever. Like that's not the conversation. That's super irresponsible. And, you know, surgeons are held to a really high standard with that. And there are people in the injectable world who carry a very progressive, innovative mindset and will have those hard conversations. And because ultimately a lot of people will sort of still elect it, but at least they're doing it knowing what they're after in the long run, you know? And
I'm so glad that you're here talking about that today, because so often we hear, oh, the pros and like, look how good this looks. And these are the injections you need in the treatments and the surgery, blah, 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 blah. But like, we're human at the end of the day. And it's like, we've got to look at the cons too. And like maybe why you don't need to go that direction. And like, I love that you're sharing all of this. And it's, you know, I'm learning as well, which is great for, you know, me obviously being interested in treatments and things down the road too. So it's good to have that balance. Okay. I want to switch gears really quick to nutrition. I want to talk about that for a second. Do you think there's certain diets that we can respond better to help us with our aging process?
Oh, geez. The answer being absolutely yes. But there's no one. I would say that too. Like, you know, I come from this framework of like my diet, you know, I honestly kind of look at my teeth and I know what I'm meant to eat. Like that's always my like, oh, we're supposed to be vegans, we're supposed to be carnivores. I'm like, I don't have teeth. I have teeth to do all those things, right? So you can almost even go to the number of teeth you have and what their functions are. Like, okay, so I just like to very first order thinking there as well, right? But when we get into then, well, what does that mean? You know, obviously, I don't think there's any question about this, like whole foods versus highly processed foods. But what's the right answer? You know, regionally, where are you from? Where's your heritage? What are you meant to be eating at different seasons? I think you can really get broken down with it. But when we get to the metabolic end, right, this is where I look at it through my surgical lens. I just, you know, have to openly admit that. And I think of like, what's causing inflammation? What is stabilizing neurons? We didn't talk about this much, but the way that I approach anesthesia for my procedures is very different. And
walk us through that really quick.
Well, this is another one of those. This is a hot, controversial topic a little bit. Anesthesia, people think it's just like, oh, you go under anesthesia, you go sleep. There's a lot of different ways to put your brain to sleep because there's a consciousness level, there's a pain level, there's all these things. And you can just like general anesthesia, which most people think of, is incredible, right? It has revolutionized things that we can do. So many things from a surgical standpoint, general surgery, you couldn't really do without general anesthesia. So it's a miracle of modern medicine to be able to do general anesthesia. That being said, it's an insult to your brain to be on it. There's just a very basic way to say it. You know, that doesn't mean you shouldn't do it, but it means it should be talked about, right? Like, okay, that's important.
There's the risk.
For what I'm doing, or let's say you're doing a hand surgery even, like you don't necessarily maybe need to be under general anesthesia because you can numb the entire hand. You can make the whole thing numb. So you can do your work. There's no pain sensation, but then there's the consciousness. Does the patient need to be conscious or unconscious? Can I handle holding still and sitting there for?
Because I've seen that with like breast augmentations. Some people can be awake.
And that's a progressive part of general. I don't do any general plastic surgery. I only work on the face, but that's a very progressive route in that. In my facial plastic surgery world, I could do these procedures with my patient fully awake from a pain standpoint, right? Like I can make them numb to the point where there's no feeling or pressure or sense, anything, right? But then like you were talking about before, they're a little bit longer procedures. And so then I get to go into like, okay, I've got the pain part covered, which is great because that also helps reduce post-operative pain, which is a whole nother thing. I do not use any opioid or like narcotic pain pills. I don't use any or during the procedure, right? And I also don't use any of this class of medications called benzodiazepines. Those would be the most common way that you'd put somebody under like twilight anesthesia, like say they're getting a colonoscopy. You give them a benzodiazepine, a narcotic, you push it real quick, you do their colonoscopy, they wake up, and then sometimes they can have kind of brain fog. We call it post-operative cognitive dysfunction, POCD. And that's all based off neuroinflammation. So inflammation is driving that. And surgery itself can create neuroinflammation, but so can the anesthesia, right? So the more gentle I am with my surgery and things like that, the more I can promote that, but then also the agents that I use. So I get to make you totally numb and then put you to sleep with agents that are relatively gentle on your brain. I'm even thinking about sleep architecture afterwards, because when we talk about recovery, hyperbarics and red light and all those things I use are incredible.
And you use that in the office?
Yep. So like I said, when you're with me, you're there for a week, and we didn't get into that, but the post process is laid out. Like, you're staying with me, you're seeing my staff every day.
That's great.
We're sending our nurses home with you to recover.
A little retreat.
Oh, it is a retreat.
Yeah,
we call them our retreat homes.
I love
They're
that.
like on the water,
cool.
Beautiful views of the mountains, fractal patterns, trees, all these.
I was looking at pictures of
things.
your practice, and it's stunning.
It's cool. Yeah.
It's stunning.
But all of those things, I would say, pale in comparison to the effect of good sleep, right? And anesthesia disrupts sleep. So I'm trying to get that better afterwards. And so, when we get into it, neuroinflammation is a big part of it. I want to reduce your neuroinflammation, which is using less anesthetic agents, using ones that don't cause as much inflammation, doing all the hyperbarics afterwards. Yes, that helps everything heal from what we did, but it also helps reduce your neuroinflammation. So there's a double benefit to those types of things. The IVs that I give you post-operatively with glutathione and NAD, these are aimed at reducing. I give you glutathione right at the end of the procedure. It's literally the last thing we give.
And I'm sure when you do that, inject that, it's how much more powerful.
Well, especially right at the end of surgery. I'm using magnesium during the surgery to reduce the anesthetic needs. But now we're bringing it full circle to your question about diets. If somebody is in ketosis when they come into surgery, we know definitively that being in a state of ketosis or ketones are neurostabilizing. So kids with seizure disorders, there's this incredible researcher in Florida named Dominic D'Agostino, who's like the king of ketones. He has shown this over and over again. And it was actually with Navy SEAL divers that they were trying to figure out when they have their rebreathers and they're getting basically oxygen toxicity to their brain, how could they reduce that? And they tried every anti-inflammatory that they could think of. This is in animal models in hyperbaric chambers, and ketones were the things that reduce. And we're talking a 50x reduction. So crazy significant. So ketones are neurostabilizing. So if somebody comes in ketosis and they have their surgery, their neurons are going to be a lot more resilient to the anesthesia.
Men or women?
Men or women.
Both,
Either way. Yep. What I was talking about with bringing a very full circle with the hypercapnic tolerance training leading into surgery. That's maybe not dietary, but it's a metabolic lever you can pull to make your recovery better afterwards.
Can you explain that? That's on a cellular level of what that's doing?
So, hypercapnic tolerance is just simply building up CO2 on purpose. Nose breathing during zone 2 exercise or walking, or there's certain sets you can do. I work out underwater all the time, do training, those are all building my ability to tolerate CO2 in challenging circumstances, which you're going to have a little bit of that in surgery. Great. So you're better at dealing with it. You're more metabolically flexible, right? Ketones make you more metabolically flexible. I give all my patients ketones before surgery, regardless of if they're in ketosis or not. I'm giving them exogenous ketone salts leading into the surgery and the day after to help them recover, right?
Do you guide them with food choices too?
Oh yeah.
Alongside?
Yep. And so I'm not trying to reinvent the wheel. If you're telling me I eat Mediterranean or I eat, okay, great. I'm not going to change your diet before you come in.
Go keto.
Yeah. But if we can optimize the things you're doing, especially if somebody's, in a rare situation on a standard American diet, my patients tend to be very, I would say high performers. And by high performers, I mean people that care and are motivated and are doing all the things, right? So I don't get a lot of people who are I had McDonald's yesterday. What can you do for me? It's that's not what we're talking about generally, as much. Or I eat McDonald's every day. How about that? So we don't need to reduce inflammation in that way quite as much, but diet is huge going in. And then, even afterwards, the IV supplementation that I use is very nutrition forward, right? The amino acid profile that I'm giving them. We talked about zinc a little bit, copper. Copper is really important to the creation of new collagen molecules. It's one of the, collagen is this triple helix, basically this trihelix, and copper is a binder in there. And so anyway,
and alongside that with collagen really quick, do the supplements that we take that are collagen, does that make a big difference on the skin?
It's so funny because I have been very sort of backed off on this, waiting for things to kind of pan out, because there's research that's relatively good research showing that taking a collagen supplement increases collagen in the skin. And then I get to my first order thinking, and we know how protein breakdown happens and absorption in the gut, right? And so I'm So you're telling me that you take a novel and you chop it into individual letters and throw it out there, then it magically reforms into, like, we have to absorb the amino acids, and, you know, and collagen is missing one essential amino acid, tryptophan, right? So it doesn't even have like a full amino acid profile in it. But now I think as we're starting, and I've just paid attention and been relatively like, don't get too excited, but if you take a collagen supplement, take a collagen supplement. Like, but it's not going to, like, studies show a benefit. Okay, great. I'm not going to argue with that, but like, what's the mechanism? Now I think that we're starting to understand that, like, our understanding of the gut's improving maybe a little bit, and maybe there's like some molecular signaling that's happening via these collagen proteins in the gut that are actually maybe like, oh, there's maybe our mechanism for upregulating. And I've seen that happen with a lot of things, like red light therapy. When I was an athlete, going back to that, using red light therapy, the data behind it was actually being blocked by some key opinion leaders in the field of like photomedicine, light, lasers, things like that. Like, oh, that's bogus science. It's not doing anything. And it blocked it, right? And then we started seeing like, well, that's not actually true. There's a lot of good things happening here. But even in the last like few years, we figured out a lot of like why something like that is helping. And like, it gets into very like things that would have been very esoteric or very out there before, understanding like, okay, why these things are helping. And I know you've talked about that before as well.
I love red light therapy. Actually, my mom's having surgery on Friday, and so I have like a little gift basket and give her some like a red light little travel thingy.
Absolutely.
So, like, use that. Like, that's, I think I'm such a believer in that with inflammation.
And it's evolved from like, oh, put it on your sore muscle or put it on your incision site to now literally like put it anywhere.
All of the above.
Like, put it on your back and it's going to help your recovery in your face.
I do with my kids too, like when they have colds or, you know, sickness, like on their throat. It helps. I'm sure you.
Oh yeah, my kids are in it with me all the time. They're like every day, you know, they're getting red. That's like a little fun family ritual. But metabolically, we know that, you know, its effect is on the mitochondria, and those things have been well elucidated. But now we also know that the mitochondria throughout our body communicate with each other, and that's where it gets real hand wavy into like exclusion zone water and things like that, which is very out there, honestly. But like in that process, putting in the greatest example of this that I could give you is like putting red light on somebody's back changes their glucose tolerance test response. Basically, like your blood sugar doesn't rise as much from having oral glucose if you've had red light on your back, versus which is like the only effect of that has to be systemic, right?
Oh, so absolutely. Anyway, Okay, one quick thing around, because we haven't talked about it, but stem cells. How do you incorporate that into recovery and your surgeries?
So in the whole regenerative medicine aspect, I think it's a really nice, helpful, promising adjunct. I also don't think it's like this amazing end all be all, like gonna right now, you know, it's a helpful adjunct. I'm using stem cells from you immediately during your procedure. So our fat is one of our richest sources of stem cells that we have. Fat, bone marrow, those are areas I could go easily get your stem cells and use them. So I'm usually using your fat anyway during our procedure. Like I said, I'm doing laser with just about every procedure that I do. I'm also generally using my patient's fat for fat transfer to the fat pads of their face.
And that gives the same effect as filler in a more natural way.
Yeah, same. That would, I mean, in a nutshell, okay, yes.
Sure, yeah.
There's nuances to that, of course, because fat I would view more as like a structural remodeling than I would like puffing it up, right? Okay. It's much less sexy. You know, it's like redoing the foundation of your house. I say like, is that sexy? Like, it makes it last longer and makes it kind of like stand up better and look better, but it's not like flashy, you know, changed, right? So I'm using it for, it's a long play. It's a long game. And maybe even going back to your question is like, what would be an early thing? Like, you know, on my younger patients I'm not doing surgery, completely non-surgical, a really common plan would be like laser and fat transfer. Or for me, it's a laser cocktail. I'm never using one laser. I'm using multiple.
Do they have to be put under for that?
Yeah. I mean, you don't have to. Like my patient in a couple of days this week has done it before and is doing it awake. But in general, I usually would be like, it's simple to go like
easier, maybe
under that gentle, like, you know, neuroprotective anesthesia protocol that I like. You know, that would be a really great one. And just to be clear for people that are talking about that, like my anesthesiologist or, you know, anesthesia professionals controlling that, not me. It's just in my operating room with my mindset. I hand chose them. We're on the same page. It's their world. I'm just kind of driving it basically.
Absolutely.
In your sleep. You are asleep. You're not like awake during this procedure. I think a lot of people get confused on that. You know, when I think about using your fat, I'm isolating your stem cells out of your fat in that process. And so it's a beautiful mix of the ability to actually like cause some qualitative change but also redo the structure at the same time, right? So when I put fat-based stem cells in your fat pads, it also makes your skin better via just this communication that it has to those areas. Stem cells are the orchestrators, the drivers of all this remodeling. And so I'm using your fat anyway. I get to use the stem cells out of it. It takes a little bit more work for me to get them because people, a lot of fat transfers like take the fat out, put it back in. That's easy and simple, but I'm taking the fat out and then I'm doing my, stem cell process. Just takes longer. And the other side is I may take, 20 cc's of fat or 30 milliliters is what it is of fat. And I might only use 10 of them because the other 20 aren't like the quality that I want. They don't have the stem cell density. And so, but it's great. It's definitely a quantity over quality type of approach to using stem cells in that. And then there's a bunch of other like ways that stem cells can be used, to support your post-op recovery, but that's definitely the most important of them because it's directly in the source of where we're working. And
did you do all these things like at the start of your career, or has this evolved over time?
The mindset has been there. The practice has evolved for sure. Yeah. And so many different, and with more data, like, if we would really want to get into, I'm like super nerdy with my fat transfer. I'm like a fat connoisseur. I'm like harvesting it and I'm getting them and we're like checking the densities and we're like, oh, and it's exciting. Like I love this part.
That's so
and then
cool.
Once I have your beautiful fat that I'm going to use, I'll put it under a red light, which is like, because there's studies and data showing that improves the fat's performance and the take rate and things like that. So super easy. I have to have a red light in my OR and we have to take the extra time or whatever, but like it's the same mechanism by which it works in us when we're like in our body. It's doing the same thing to the stem cells in the fat. It's affecting the cytochrome C oxidase. It's changing the inflammatory macrophage profile of when I put it in. It's helping it create more blood vessels to itself, which is how it ultimately survives. Super nerdy, but extra steps to, especially in my world, like if I can get a 0.5% improvement in your result with these little things, let's do all of them.
That says a lot about you.
Yeah. I mean, it's an obsession with the results ultimately, a healthy obsession with the results. Yeah.
But I love that. And like, I feel like this was not talked about 15, 20 years ago.
No,
so to think where it's going to be in 10 to 15 years is.
Yeah. Even that right there that I just described is like,
I didn't even know that was a thing. So
that's going to get eye rolls from my colleagues and then watch what happens in 5 years.
We're gonna go
Everybody
back to
will be doing
this
it.
Episode, guys.
Yeah, right. I'm not even kidding. That will happen. People will, because again, everybody is resistant to, to innovative thinking. That's one of my key values for sure.
To your point, like I knew I was gonna sit down with you and just, I know this is for my listeners, but just as much for me too, because I'm so interested in this, and I think that what we're missing, and you said that, is that critical thinking component. To the way aesthetics and facial surgery is managed. I mean,
ultimately my practice was built off before and after photos, right? Which are now before and after videos because things have changed. And that's great. That's a good thing.
They can't be altered that way, really.
Well, I can't. I think I actually really, this is a fun little sub note, but I love having all of them. So you'll usually, if you look at my socials, you'll see me posting still before and after photos, which I don't touch. There's no reason to touch them, right? And I never have. And then you have videos of just like scanning videos. And then you have videos of them talking and moving usually. Like that's the whole spectrum, because it's funny when we get into our neuroanatomy, if I just see you walking around and my brain's in a completely different state, it's in all of those sort of subconscious than if I see a before and after photo right next to each other. If I see a before and after photo right next to each other, I instantly go into my frontal cortex, the most advanced part of our brain that is analytical. What is different in these two photos? Without that, so in daily life, when you're walking around, let's say you have a procedure done, nobody has your before photo. They're not in their analytical brain. This is why the celebrity thing is so uniquely powerful. And I don't think anybody talks about this. Like celebrities get this bad rap because they had this procedure. If you didn't know what that celebrity looked like before and you saw them walking around now, maybe it's not optimal, but you probably wouldn't pick up. But you just happen to have that person's before photo etched in your brain because they're famous, and now they get all this bad press.
That's such a good point.
And so that's the neuroanatomy. Like so anyway, I like before photos, before and after videos, and then I like dynamic stuff. And that's what my practice is built off of. My practice couldn't exist without that. Like I'm fully travel based. Like even in the last decade or two, the paradigm of like, you go to your local surgeon and hopefully they do a good job when they align with you and you guys are vibing. in my world now, this is so beautiful. Honestly, I'm so grateful for this. Like, as much as the challenges of social media, I'm also so wonderfully grateful that it's allowed me to build a practice that I love, working with people that I want to work with forever. And that's so unique. I literally couldn't have happened 20 years ago. Couldn't have happened. 0% chance.
I know. I feel like technology and like social media specifically can sometimes get a bad rap.
Yeah, and it does.
And even in my career, like I wouldn't be where I'm at if it wasn't for social media and
100%, right?
You being out in the middle of nowhere.
Right. Yeah. In a good way.
It's beautiful there. I'm like, I need to visit. But like it's great for you as well. And speaking of social media, this is like, before we get into our rapid fire, the last question I want to ask you, how do you think social media has affected people when it comes to changing aesthetics in a positive way, but also a negative way? Yeah,
I think that there's pros and cons to it. It drives trends, unfortunately. I'm just not a person who follows trends, right? Like buccal fat pad removal. Like I don't ever remove it. I lift it if it's sunken, right? I'm one of the only people, maybe the only person who does that currently. That'll be my next contribution to the field, hopefully, describing how I lift that. But so social media drives trends, right? And I think you can see that. And if you look at the definitions of beauty over time, and it's probably evolved the most rapidly in this time frame of social media, just because it's out there. It used to be magazines driving it, or celebrities, or the monoculture. A friend of mine calls it the monoculture, like of all the A-list celebrities. That was like the only person that everybody in the world could see, right? But now that changes, and what you see is different than what I see, and because of algorithms. And so the trends get driven in these some very odd directions, honestly. But at the same time, like I just said a second ago, I'm grateful that you can hopefully, your algorithms push something to you that resonates with like what works for you. Because, I hear it at the beginning. When I look in the mirror, it doesn't match what I see. And my best compliment, and I get to hear this all the time, thankfully, is like, I just like see myself again. When I look in the mirror, I feel like myself. And we're not trying to make you into something you never were. We just want you to like, and that changes how you show up in the world, right? There's a functional part of this too. There's like a performance part of it a little bit for a lot of people, in addition to the removing that cognitive dissonance. And so if you can pick that up through socials, I think that's really, really valuable, to it. And again, so pros and cons very much,
It's a good answer. Okay. Are you ready for a little rapid fire?
I guess so.
Most underrated anti-aging habit?
I want to say sleep, but I'm going to go actually to blood sugar regulation.
Oh, love that. That's a good one. Most overrated aesthetic trend right now?
Tightening devices and filler.
One treatment that is worth the money?
To blanket it, I'm going to say laser for skin qualitative improvement.
That's the big guy. Yeah. You taught me that, like skin quality versus big change.
Yep.
What's one treatment most people should skip?
I'm going to go into my surgical lens. Any isolated procedure, that being an eyelid surgery only, a neck lift only, a lower facelift. Avoid those things. They're flawed logic.
Best thing someone can do naturally for better skin?
And I know you've had a lot on here about like topicals and sun protection, but I'm going to say a mix of like controlling inflammatory and oxidative stress, and which sun falls into that category a little bit.
Okay, this is a little bit more specific, but if someone only had $100 to spend, what treatment? Which I know like that's probably not in a budget, but you know what I mean? Like
in that vein, I can answer in that vein for sure. I would say along the lines of either microneedling, and again, or getting a home micro. I don't even do that, but get a home micro roller, something to cause that little stimulus of injury. I would say, let's say in-office microneedling. It's going to be more than that, but in the vein.
Okay, I love that. One supplement almost everyone should take.
Creatine.
That's my answer.
Oh,
and
all
then
right.
magnesium.
Yeah.
And protein, if you can't get it from Whole Foods. But if you can, that's great. All right. Sorry, I'm going off on a tangent. What's one thing that you personally would never do to somebody's face?
A lower facelift. Just because you hear that, a mini lift. How about
a mini lift?
A mini lift. There's no, that it's not even a thing, but that concept of like trying to cheat
underneath,
versus like doing what needs to be done.
Okay, red light, sauna, or cold plunge, if you had to pick one.
Doing all those together.
You're like all of the above.
I do all those together. From my surgical lens, red light, because there's dramatic help with improvement. From my actual real life longevity lens, if I could only pick one, it would be sauna for sure.
That's
for the longevity benefit.
I love red light, but sauna's a good one.
I do them together.
Right. Oh yeah, that's the best way. You're non-negotiable for longevity.
Exercise, the most magical, most challenging pill that would, if it was a longevity, you hear this and it's so true. If it was a longevity drug, everybody would take it.
I love that.
So easy to do. The creatine one, can we just go to that real quick?
Yeah.
So funny, because I've been using creatine, probably, let's say like as a regular for 10 or 12 years in my patients. Like I have them start it before surgery. And this just speaks to this funny evolution that I've seen where 10 or 12 years ago, it was so novel for my female patients to even consider creatine. It was like nobody was on it. So they were starting it for the first time pre-coming to me. And it was like so novel, a lot of conversation, now, flash forward 10 years, it would be exceedingly rare that I would have a patient who's not already on it. And so I'm like, what,
it makes me so happy too.
Yeah.
It's interesting. I've talked about this before, but I can't unfortunately handle like the full like 5 grams when serving of creatine that most supplements put in their bag, the dosing, because I get acne.
Oh.
I'm like one of that really small percentage. And I've cycled so many times. Like I know that is what it is. I've tried different brands. I can do like 2.5 grams, but I love the way it makes me feel. Like there's just so many benefits to it. Obviously longevity too, but it's a good one.
Yep.
Okay, last question, not a rapid fire question, but it's something I ask all of my guests that are on here around empowerment, the theme of the show. So what does empowerment mean to you?
I think empowerment is working towards your unique core values in a way that's meaningful to you. And I think the key to that is the thing that most people don't do, it's hard to do, is sit with yourself quietly long enough to really define what your core values are. I think it's an exercise that everybody should do. I have all my fellows that I'm teaching do this, like, what are your core values? What are the things, let's just pick 5 that you're trying to fulfill. Because empowerment, and it's different for everybody. Like, one of mine is excellence and innovation and integrity and leadership and presence. And that's why I love what I do, because I get to kind of tick all of those key values off, or with my family. But if you're not working towards something that is meaningful to you, it's hard to be empowered in that. You're just working blindly, basically. So I think that's in my world, the definition of being empowered is like, I'm working hard and I know what I'm working towards.
And I love what you said too about just like sitting with yourself in that silence, which I feel like we don't do as much.
Right.
Just to sit still and like dive within. So that's
it's hard. I mean, like, and I was eating breakfast by myself this morning, and I was like, I'm going to just like put my phone away and just like be quiet and not talk to anybody and just sit. And I'm not going to lie, it's kind of awkward.
It's uncomfortable.
Yeah. But how many years ago, that was the only option you had. Maybe you had a newspaper or something, but no, I just
not many distractions. I feel like a newspaper is not that much of a distraction, so I can only imagine.
It felt very weird, and I definitely enjoyed my food more. So that's interesting.
There you go.
Yeah.
I love that. Well, thank you so much for coming on. Yeah. Can you tell our listeners where they can find more about you, your practice, and if they want to work with you? Yeah, I'm on all the socials. I'm most active on Instagram. That links to our website, clinic5c.com, and that's where all the information. That's also the way to start. I start the process virtually every time with everybody. It's very simple, no cost, to submit photos, get an opinion. And sometimes it's here's things we could think about in the future. Sometimes it's a yes right now. Sometimes it's just like, oh, you're not a good candidate for these things. So it's a really simple way to just like, kind of like, other than taking photos and giving me some information, very low friction process to get things rolling. I love that. Yeah. Well, thank you so much for coming on. For having me. I'm so excited for listeners to hear it. Absolutely. Thanks for tuning in. If you enjoyed today's episode, don't forget to like, subscribe, and share it with a friend. It really helps us grow and bring you more great content. See you guys next week.